This is a 22-year-old patient who presented to the office with a complex TMJ disorder that was verified with MRI imaging. His TMJ disorder is exacerbated by his Tourette's syndrome. I am making no claims in making any cures for his Tourette's syndrome, but simply managing his TMJ disorder by utilizing Dr. Brandon Stacks and Dr. Anthony Sims' protocol. So we had Tyler come in, and he has Tourette's, and he started at the age of 5, as the symptoms one was saying, and then he was diagnosed officially at the age of 10. Okay, and then can you just go through in terms of the symptoms and what you?
I have abdominal twitching, neck twitches, eye blinking. Sometimes my mouth opens wide. Yeah, sniffing. So I haven't had that for a long time.
He doesn't like when we do that because
it kind of triggers it.
When we talk about it, it's like it triggers it.
It triggers it. Okay.
So he doesn't like
That's pretty much it, though.
Okay. Chomp really hard. They're just coming back?
Not yet. You start feeling how
Is it as intense?
No, not even close.
Just give it a couple minutes.
You set that up and so you want down.
I put in already in use.
The patient returns 6 weeks later and reports a reduction of symptoms. He also gets his upper appliance inserted. Yeah, okay. So from last time I've seen you, just describe to me like what differences you've seen, or if it's gotten better or worse in terms of the tics or the urges.
The urges have gone down a lot, but they still see the tics. But I'm starting they're starting to decrease, and then they will come back a little bit more, but it's not as bad as it used to be.
And then the intensity of the movements. So you find that the actual movements are less intense?
Yeah.
Okay, how much of a reduction do you see?
60.
So about 40% better then? Okay. And then how much do you feel overall different though since we've first seen you to today?
Quite a bit. Like 75% when we first started.
Okay, so 75%
When I first came in the first treatment.
Yeah.
Until now, yeah.
So 75% better or 25% better?
I think 25.
25% better, you feel?
Yeah.
Okay. The patient returns 4 weeks after getting his upper appliance inserted. Okay, Tyler, can you go through in terms of how the frequency and duration of your motor movements before treatment and then now as we've started?
Yeah. Before treatments, I was 24 hours nonstop. When we first started treatments, I would be about 4 hours, over an hour break, and then come back up. And now I'm only at about 15 to 20 minutes of ticking, then a couple hours, and that was about 5 to 6 times a day.
And how much of an improvement would you see in terms of the tics, would you say?
About 80%,
And then what about your urges?
85 to 90, as of today.
Tyler, in terms of your sleep, I just want you to describe how the difference is before inserting the upper appliance versus before we started treatment.
Before we inserted it, I was waking up every night either in pain or from massive amounts of tics. And now that we've inserted the upper appliance, I can sleep almost through the night without any pain or tics.
How much of an improvement would you say is there in your sleep then?
95%. Easily.
Sleeping wise, you were saying before that you would hear the bed moving at night.
Yeah.
How has that been in the last month, or like since December when we inserted the appliance?
I haven't
Is
noticed.
that besides me just trying to get comfortable?
Yeah, like I say, I haven't noticed the movement as much when he has gone to bed. So he tells us he is a lot more calmer.
I just had those couple nights with that mouthpiece in.
Yeah,
Where it
with the
woke
night
me out of
guard.
dead sleep.
He did try that, but he had to take it out.
But with the appliance on the top, though, everything
Oh,
is.
that's, yeah, it's been really good.
And then you're talking about in terms of your sleep. When's the last time you've slept like this?
Maybe on sleeping pills. So not for a long time.
Okay, so right now, though, do you sleep through the night then?
Other than to go to the bathroom, yes.
Okay, and then so the last time you slept through the night, how long has that been? Could you recall then? Where?
No. Never.
And he's, no, when he says sleeping pills, would it be melatonin?
Yeah, just natural stuff.
Yeah, natural, trying to get, he's never, since he's been diagnosed at the age of 10, he's never had a restful sleep. Because I would check in on him and he would be
Fish out of
bouncing.
water.
Yeah, that's how he calls it, a fish out of water. Even while he's supposedly sleeping. So that deep sleep, I don't think Tyler's ever experienced a deep sleep.
Do you find that you sleep deeper now?
Yes. I've always been a light sleeper too, but I've been getting a lot deeper.
Right.